To find out if you qualify for a complimentary consultation, call our office today at 407-977-3842. This visit is normally $245, but will be provided at no charge to those who qualify today. This offer is only for those who have been previously diagnosed with type 2 diabetes and are currently taking medication. Call now or visit myiho.com.
Welcome back. Today we are talking to Dr. Marc Ott and Dr. Heather Carter from Integrative Health of Orlando about the epidemic of type 2 diabetes. So doctors, tell me a little bit about what some of your patients have experienced with conventional therapy before they came and met you and your cutting edge therapy.
Well, first of all, the patient goes to the doctor, not so much to get diagnosed with diabetes, but they go for a physical, or if they're not feeling well, or something else is going on. And at that point, the doctor will order a blood test, and when it comes back, they'll sit the patient down and tell them that they're diabetic. And that's typically where the diagnosis comes from initially. And then from there, that doctor will tell them, you need to lose weight, you need to diet and exercise, and come back and see me in a few months. But they don't always tell them exactly how to do all of those things. Yeah. And then from there, they go back in a few months, and the patient hasn't lost any weight because they didn't really know how to diet. They didn't know how to lose the weight and exercise. So the doctor starts talking prescription medication there in the next few months.
And they're probably still in shock, I would think, from that type of diagnosis.
Yeah, patients leave that visit, I think, devastated most of the time. I've talked to patients who tell me they went home and cried afterwards, and complete disbelief. They don't know how they got there. I have patients over and over ask me that question, like, why me? How did I become a diabetic? Why nobody else in my family necessarily is? I'm the first, or I don't fit the mold of the typical diabetic. I'm not overweight, So I think patients do, they leave that office really feeling like they're in shock, like you said.
Yeah, and they're probably worried, and they feel guilty, and what did they do wrong, and really just don't even know what to do next.
Right, exactly. And like I said, when they're put on those medications for their blood sugar, they'll start off typically on a pretty low dose of the medication. But then after a while, the blood sugar continues to run high, so the dosage of the medication continues to increase as the blood sugar is increasing. And then after a while, the blood sugar medications start layering on. And they'll be on multiple medications at the same time, and the blood sugar is still out of control. And the patient just feels out of control too.
What are some of the feelings that they have, physically, when they're on so many different medications and still their blood sugar is not right?
Yeah, the medications oftentimes have a lot of side effects associated with them, and then the disease itself, of course, has a number of symptoms associated with it. These people are usually devoid of any energy. They're not sleeping well often during the night. They find themselves falling asleep at all hours of the day. They can't concentrate. They find that their mental acuity has really changed. They don't have energy and the motivation to go out and really participate in life anymore. And so what's happening is that their treatment is really aimed at dealing with symptoms more than anything, and never really addresses those underlying causes. And we find patients asking us that question all the time, like, why am I a diabetic? How come no one's ever been able to answer that question for me? No one really thinks to ask the question of why. So they get diagnosed, and the testing is done to figure that out. And so great, now I'm a diabetic. Well, why? And over time, from time of diagnosis, they watch as time passes, the disease gets worse, and as Dr. Carter said, the medications start increasing in dose, and then additional ones start to get layered on because they need to be to control where the blood sugars are going, until finally insulin starts to be discussed. And at that point, things really start going downhill.
Well, that has got to be really frustrating. After the break, we are going to ask the doctors how their treatment of type 2 diabetes is so different. So don't go anywhere.